You may know that hormone replacement therapy can help relieve your menopause symptoms. That's true whether you went into menopause naturally or you had a hysterectomy and were basically slammed into menopause immediately after your surgery. But did you know that women who've had a hysterectomy that don't take hormones, specifically estrogen, are more likely to die than women who take hormones? A major research study out of Yale University estimated that at least 18,601 women, but maybe as many as 91,610 women, died unnecessarily between 2001 and 2011 because they didn't get hormones after their hysterectomy. I'm Steve Goldring, the hormone pharmacist from simplehormones.com. I've earned multiple certifications about hormone replacement therapy. I also work with hundreds of hormone doctors to help women just like you with hormone-related symptoms and risks. The symptoms of menopause are bad enough: hot flashes, weight gain, irritability, mood swings, depression, anxiety, insomnia, vaginal dryness, painful intimacy. But women I talk with aren't always aware of the risks that menopause brings. I'm talking about long-term health issues that are much more common in women who've lost their hormones at menopause, whether it's natural menopause or surgical menopause. The biggest health risk that comes with menopause is heart disease. Women in general have a lower risk of heart disease than men do, until you get into menopause, when women start catching up. Dr. Philip Sarrel and his team at Yale University carefully examined the data from a giant study called the Women's Health Initiative. Sarrel and his colleagues were especially interested in what was called the Estrogen-Only Arm of the WHI, or it was called the WHI Estrogen Alone trial. A subset of women in that big study had gone through surgical menopause. They had had both their uterus and their ovaries removed for one reason or another. The results of the estrogen-only arm of the WHI are shocking and pretty much unknown to a lot of people, even up to this day. Sarrel was interested in this arm of the study because the women who had no uterus were given either estrogen only or a placebo. The shocking thing was that women given placebo had significantly higher all-cause mortality than women who took estrogen. That's a very big deal. Women taking estrogen died less often from any cause of death than patients taking placebo. The estrogen-only arm of the WHI confirmed about a 30% lower risk of heart disease in estrogen-only users. The estrogen-only patients had a 63% reduction in mortality because of invasive breast cancer. Sarrel and his team did a bunch of complicated calculations that I won't even try to explain. But the bottom line is they looked at scientific estimates of women 50 to 59 years old who got hysterectomies between 2002 and 2011, who either did or did not get estrogen replacement therapy. The research team was aware that hormone replacement therapy dropped off like a rock after the Women's Health Initiative results were announced in 2002. Women basically panicked and they all started throwing their hormones down the toilet, which, by the way, is a terrible idea. Once those hormones get into the water supply, they're never coming out, but that's another story. Sarrel's group calculated the number of women who went into surgical menopause but didn't get estrogen. Of those women, a certain number would have died between ages 50 and 59, but Sarrel published a paper estimating that at least 18,601 deaths would have occurred because those women didn't get estrogen, and that's on the low end. Sarrel also had a high-end calculation of 91,610 women who died unnecessarily because they were denied hormone replacement. In other words, somewhere between 18,601 and 91,610 women died unnecessarily because they had gone into surgical menopause and didn't get HRT after the Women's Health Initiative. Again, the excess deaths were mainly due to heart risks. As I mentioned before, heart risk is lower in women, but they catch up after menopause between the ages of 50 and 59, the exact age range that Sarrel was looking into. If you've had a hysterectomy and your doctor's told you you don't need hormones, you may want to get a second opinion. I might be able to help you with that. I know several hundred providers all over the US, Canada, and even a few in the UK who specialize in hormone optimization. Visit my website at simplehormones.com/referral to find a provider near you. You can also click on the link in this video to request a referral to a hormone specialist. I'll see if I can recommend one near you. Can't guarantee anybody. If you found this video helpful at all, click the like and subscribe buttons. You might also want to ding that little bell to get notified anytime I post a new video. Thank you so much for watching, and I'll look forward to talking to you again next time.